Hello, I'm Todd Didier, Senior Manager of Communications at the Primary Care Collaborative. Every month, the PCC honors thoughtful, innovative leaders who are helping promote the promise of primary care. This month, I'm thrilled to welcome two leaders at CMS, Deputy Administrator and Center for Medicare Director Dr. Meena Seshamani and Deputy Administrator and CMS Innovation Director Liz Fowler, who we are recognizing for their leadership in the development and launch of the ACO PC Flex program. Meena, Liz, welcome. Kicking us off here, what role do you feel primary care can and should play in the American healthcare system? And why is primary care an important part of delivering the best possible care for seniors and people with disabilities?
Well, thank you so much for the honor of being co-named a primary care champion. And absolutely, I'm a primary care champion, in part because I'm also a surgical subspecialist. I'm an otolaryngologist by training. I was taking care of patients up until I took this role, leading the Center for Medicare. And I know how important it is for people to have someone who is taking care of all of them as a person, right? We are all more than the sum of our various ICD-10 codes and our various organ systems. And the number of times as a healthcare practitioner where I had someone coming to my office, for example, with dizziness. And as an ear, nose, and throat doctor, I'm looking at their ears and determining, okay, are the ears contributing? There are so many other things besides the ears that can contribute to something like dizziness. Cardiovascular disease, behavioral health, reactions to side effects to medications. And from my purview as a specialist, I'm not necessarily able to see that. And that is what a primary care doctor does. And it's so important that we have primary care doctors that are supported and able to care for people the way that they want to be cared for and the way that why people go into the healthcare field. So it's been very important to me in my role to really be able to support primary care because it really serves as a cornerstone and foundation for how we want to innovate to provide whole person care to everybody in our country.
Well, my colleague Meena Seshamani said it really well. And I think just to reiterate, as everyone here already knows, primary care is really the foundation of a high-performing healthcare system and fundamental to improving health in the United States. We know that people who have access to high-quality primary care are more likely to receive preventive health services and screenings and to experience improved health outcomes related to mortality, disease progression, and chronic condition management. It's really, as Meena said, that integrated, team-based, coordinated care that's really key to driving better outcomes. And that's why the primary care foundation is the cornerstone of the Innovation Center's goal for health system transformation and our vision for a health system that achieves equitable outcomes through high quality, affordable, person-centered care. And it's also why the Innovation Center has spent more than a decade testing innovations in primary care and drawing lessons from that experience to inform our strategy to do more to promote and support primary care.
Meena, the ACO PC Flex model is designed to encourage more primary care practices to participate in and lead accountable care organizations. Why do you believe engaging primary care in ACOs is so important?
The goal of transforming our healthcare system is so that we can care for people across all of the aspects of their lives that impact their health. And primary care is the foundation for that. In fact, our data shows this. In our Medicare Shared Savings Program, ACOs, those that are comprised of 75% or more primary care physicians, they share in nearly double the savings of other ACOs. Because again, it's so important if we can care for people, prevent illness, keep people healthy, then we avoid hospitalizations, we avoid ER use, we can streamline, medications and all the things that we all know mean that you're providing better care, you're improving outcomes, and you're spending money in a smarter way. So primary care really is the foundation for this and why it's so important that we continue to partner with the Innovation Center to innovate on the Medicare model to be able to support primary care towards this end.
Liz, for the primary care team struggling to care for patients the way they'd like to, what can ACO PC Flex do to help?
Well, first, let me acknowledge that over 30 organizations and patient groups, including the PCC and NACOS and others, called on CMS to adopt a hybrid payment model in the Medicare Shared Savings Program. And we think that ACO PC Flex will give primary care providers and ACOs a new pathway to join and succeed in value-based care. The model's flexible payment design is intended to empower participating ACOs and their primary care providers to use more innovative, team-based, patient-centered, and proactive approaches to delivering care. It provides two new payment mechanisms for participating ACOs, a one-time advanced shared savings payment that can be used to cover costs associated with forming an ACO, in addition to administrative costs to implement the model's activities, and then a monthly prospective primary care payment that shifts payment for primary care away from fee-for-service, visit-based payments, and towards a more predictable, stable stream for primary care funding for low-revenue ACOs. So we think it will bring more predictable cash flow, offer more predictability, and flexibility, and a stronger incentive for providers to work together to coordinate care and meet the needs of people with Medicare.
What other approaches is the administration taking to support and engage primary care practices?
Well, from the perspective of the Innovation Center, we're focused on three priorities. First, successful implementation of the three models we've announced that I think many of you are familiar with: the Making Care Primary model, the Primary Care Ahead model, which is part of the Ahead model, and the ACO PC Flex. And then second, thinking and planning for what comes after ACO Reach, innovations that can be housed within the shared savings program, and then potential standalone models. And this entails a lot of thinking and working together with Meena and her colleagues. So we've got a working group between the Center for Medicare and the Center for Medicare and Medicaid Innovation, and we're thinking about what that future looks like. And then third, I would say we're really focused on efforts to reach and engage practitioners who haven't come into value-based care. Who and where are these providers, and why haven't they joined? And what more can CMS do to support them? And again, that's partly a joint activity with Meena and her colleagues, but central to our mind is how do we reach, particularly some of those small independent practitioners who maybe haven't joined a model, haven't been part of the shared savings program. Maybe they serve underserved beneficiaries. What more can we do to bring them in?
Yeah, building from where Liz left off, where we can support smaller providers in rural and underserved areas to engage in these more holistic care models. A great example is where we in the Center for Medicare took a model that was successful in the Innovation Center, the ACO investment model, and we scaled it in the Medicare Shared Savings Program. So now, through the Advanced Investment Payments program, we are providing upfront investment dollars to 19 new ACOs in underserved areas, providing them with upfront resources, money that they can use to invest in teams, invest in infrastructure, to become an accountable care organization. That is a direct financial support of smaller practices. Beyond that, beyond the work that we're doing in collaboration with the Innovation Center that Liz spoke about, we're also looking to where we can support primary care throughout the basic foundation of the Medicare program. So, for example, graduate medical education. We, thanks to congressional action, have 1,000 new GME slots that we have been rolling out, 200 a year over 5 years. We have been prioritizing those slots to rural and underserved areas. And the majority of these slots have been going to primary care and behavioral health, because we know that we need to bolster the primary care workforce. We also have been working to take lessons learned from Innovation Center models to really embed in the very physician fee schedule that can really bolster primary care. So, for example, for the first time, Medicare now pays for community health integration. Community health services that are integrated with primary care, paying for care navigation, paying for caregiver training. These are all services that primary care practices provide that are really essential for people to be able to stay healthy, to address the needs of communities, but were not paid for previously. Now there are payments associated with them. And as you all know, we also finalized an add-on payment code, G2211, that is an add-on payment code specifically designed to provide additional payment to recognize complex longitudinal care, which again is the cornerstone and the strength of primary care in how it can support people who have multiple chronic conditions, multiple social needs. So those are just some examples of, in the very chassis of the Medicare program, how we are looking to support primary care and how we are looking to then enable a lot of the innovations to actually change the way that care is provided moving forward to, again, support the promise that primary care has for improving the delivery of care in our country.
Okay, and wrapping us up here, if you could snap your fingers and change one thing in the American healthcare system, what would it be?
Only one thing, Todd, only one thing. I think I wish we could move faster. We have a vision for where we want the health system to go. And if I could snap my fingers, I would want to move to that vision of a health system that achieves equitable outcomes through high quality, affordable, person-centered care faster. And that, of course, as we've talked about here, entails a strong primary care foundation. So if we could build that foundation and make sure that primary care was in a place where it feels supported, sustainable, where practitioners feel happy about practicing medicine in that team-based care environment, and they can care for the patients the way that they want. If I could do that tomorrow, that would be my wish for the system.
So I agree, snapping your fingers and only being able to change one thing in our system. But I would say one thing that I would change is that connectivity across all parts of people's environments that impact their health. Because I know that primary care practitioners definitely want to be able to address all of the aspects that are of someone's life that are impacting their health, their housing, their food, their transportation. And you don't necessarily know what is happening in those environments. And to be able to better communicate, both to get data to understand what your patient populations are dealing with, and to be able to communicate with people who can help in those areas so that you can make sure that we're all wrapping our arms around the people that we seek to help. It's a challenge even within the traditional healthcare system to know when someone that you're caring for is getting admitted to the hospital somewhere and making sure that they know about that person and what medications they're on, et cetera. So I think there's still quite a bit of work in the underlying information flow and being able to really break down a lot of those barriers and enable all of us to ultimately speak the same language with each other so that we can better coordinate and really wrap our arms around the people that we are taking care of.
Thank you both so much. And thank you for all the work that you've done on the ACO PC Flex and other innovative programs that are helping enhance the health of Americans across the nation. We appreciate you and the hard work you're doing, and we're thrilled you are our primary care champions of the month.